everybody. In our presentation, we're going to be talking about the role of welfare programs in our society and an innovative proposal to make them more effective. I'll be drawing an article that was assigned from the Desert News titled Perspective, America Needs One-Stop Shops for Benefits Like Welfare Square. This piece highlights how our government's social safety net, while massive, often fails to reach those who need it most due to bureaucratic hurdles. First, let's break down the article's core arguments. So it argues that the U.S. spends over $4 trillion annually on social supports, like SNAP for food assistance, Medicare for healthcare, and child care subsidies, and also more. That's 5 times our military budget. Imagine a single mom in Utah earning $24,000 a year. She might qualify for 22 different programs, but she'd have to trek multiple offices spread across miles and miles during work hours without reliable transportation or internet. Online tools like benefit.gov are inaccurate, and honestly, many people, especially in rural areas, the elderly or people of color, don't even know they're eligible for them. Pre-COVID, fewer than 1 in 4 kids got the child care subsidies they qualified for, and 8.8 million eligible for Medicare remain unenrolled. This article proposes a solution: benefits depots, physical one-stop shops where all federal and state programs are under one roof. Staffed by experts who guide like a personal shopper, these depots would centrally be located near bus stops, stores, or food banks for easy access for the people who need it. They could even include mobile benefits buses for the homeless or remote communities. The model, Welfare Square in Salt Lake City, a centralized hub run by the Church of Jesus Christ of Latter-day Saints, that's helped for the needy for decades. Other examples include Service Canada, with its single access points and high satisfaction rates, or Wisconsin's Aging and Disability Resource Centers that cut through program mazes. So why does this matter in American government? It ties into federalism. Benefits are often administered at the state level, creating a patchwork of complexity. It also speaks to bureaucracy and efficiency. President Biden's $1.75 trillion human infrastructure bill aimed to expand these programs, but without streamlined access, it's like pouring money into a leaky bucket. Proponents say depots would save lives, reduce waste, lower long-term health and social costs, and rebuild trust in the government, which is at a low of only 36% of Americans think it helps people out of poverty. Critics might worry about the upfront cost or more government overreach. This brings us to our debate. Is welfare helpful or is it harmful to American society? We hear from our debaters. First, on the pro side, arguing that welfare is helpful, and on the other side, that welfare is harmful. They might point to dependency, fraud, or disincentives to work. So let's hear from them.
Hi, I'm Holland. I'm one of the harmful side debaters for welfare. Typically, when we think about government benefits like SNAP, Medicare, or child care assistance, we usually picture programs that are meant to help the people who need it the most. But according to several researchers and commenters, the way our systems are set up and designed, it makes it harder for people to get the help that they need and get back on their feet. One of the main reasons for this is that the system is just simply too fragmented. People tend to fall through the cracks. Deseret News article from 2021 pointed out that millions of Americans who qualify for benefits never receive them. Less than 1 in 4 eligible children, get their child care subsidies. And about 8.8 million people who qualify for Medicaid aren't ever enrolled. This happens because the system is so incredibly fragmented. Someone might have to visit one office for food assistance, another for health, and a third for child care. Each program has its own forms, its own deadlines, and its own eligibility. For many working parents or anyone without access to transportation, that's just way too much. The result is that those who need help the most often don't get it. The article describes this as a failure of design, not intent. The United States has the programs, it's just that the process to reach them is way too complicated. When we compare our system to what other countries are doing, it's clear that there are different and better models out there. For example, Canada uses Service Canada centers and a single online portal where people can apply for multiple programs at one time. That's a level of coordination that U.S. systems just don't have yet. The next main reason for why our welfare is harmful is that we don't have a center, a one-stop shop that also encourages work. The Deseret News piece proposes creating benefit depots or community service centers or community centers where trained staff help people access every single kind of benefit or welfare there is in one single place. These depots could be located near public transit, grocery stores, or food banks, places that people go. Or maybe there could even be mobile buses called benefit buses to reach rural areas. The idea is to cut down on red tape and confusion so people can spend less time navigating the bureaucracy and more time improving their lives, which is exactly what these programs were designed for. This connects to another article from the Daily Signal titled "Welfare System is Anti-Work." The article argues that the current system sometimes discourages people from finding jobs because when they start earning income, their benefits go down. They lose more in benefits than they do if they work. Researchers in that piece described the system as anti-work and said many people want to work, but the incentives don't make sense. They propose reforms like wage subsidies and better guidance to help people transition off of benefits gradually. This is where the one-step model could help even more. Imagine if, instead of navigating 5 different agencies, you could sit down with one counselor who explains how working more hours could affect their benefits for food, housing, and child care assistance in one place, and helps you plan for that transition. With that kind of guidance, you can make the system, the guidance could make the system not just simpler, but way more empowering and way more fair. So both articles highlight different sides of the same problem. This Deseret News focuses on people being left out, while the Daily Signal warns people about getting stuck. But together, they point towards a shared solution. A welfare system that's coordinated, transparent, and built around real human needs, not the paperwork. Creating a one-stop benefits depot could help people actually use the support for what it's meant for them, and make it easier to move forward when they're ready to work. Thank you, that's all I have.
Hi, my name is Lizzie Davis, and today I will be arguing that the welfare system, as it stands, actually does more harm than good, mainly because it discourages work and creates a long-term dependence on the government. When reading across articles, the main theme came up again and again that welfare discourages work. The idea is that many welfare programs are structured in a way that makes working almost pointless. When people on benefits start earning money, they lose those benefits so quickly that they barely end up with more income than before. In other words, the system punishes people for trying to work. The Daily Signal actually called the system anti-work, quoting researchers who said welfare can turn work into a threat rather than a reward. The Washington Times went even further, arguing that in some states, welfare pays better than a full-time job, so people make the rational choice not to work. It's not laziness, it's just bad policies. And this isn't just about the money. Work gives people purpose, pride, and independence, but when the government replaces that with a check, we start losing something much deeper, our sense of responsibility and motivation. The Washington Times warned that welfare is becoming the new work, which is honestly kind of scary. Welfare also creates long-term dependence. The American Spectator described how welfare can trap people in what they called behavioral poverty, where generation after generation grows up depending on government aid instead of on themselves or their families. It's not helping people climb out of poverty, it's locking them in. This dependence doesn't just affect individuals, it spreads through communities. The Foundation for Economic Education pointed out that the welfare state encourages people not to plan for their own futures because they expect someone else, usually the government, to handle it. Over time, that changes people's habits, their motivation, and even their values. Families start relying on welfare as a normal way of life, and children grow up seeing dependence as the default, not the exception. The American Spectator argued that this cycle weakens the foundation of society by eroding the work ethic and the sense of personal responsibility that makes communities strong. Even the Daily Signal pointed out that many welfare recipients actually want to work, but the system itself traps them. It's not a safety net anymore, it's a cage that keeps people stuck. So when we talk about reforming welfare, it's not about being cruel or taking away help from people who need it. It's about redesigning a system that currently hurts the very people it claims to help. If we keep a welfare structure that discourages work and builds dependence, we're not solving poverty, we're just making it permanent. That's why I believe welfare in its current form is harmful. It should be a hand up, not a handout. And right now, it's the opposite. Thank you.
Hi, I'm Connor Daigle, and I'll be arguing why health welfare is a good thing. The first thing I want to say is that welfare isn't just a political or economic issue. It's also a moral one. I think that as a nation, we have a responsibility to help people who are struggling financially. People don't choose to be born into poverty or suddenly face unemployment, and I think it's our moral duty, or I think it's the moral duty of the more fortunate people to at least try and help those who are struggling. By providing welfare, we're making sure that people aren't just left behind because of circumstances that they can't control. My second point is that welfare isn't just a handout, it's also an investment in our future. When welfare is provided to Americans, it gives them a chance in the long term. By giving children food, healthcare, and education, it gives them the tools that they need to succeed in the long term. And also, children who are raised in stable households have a higher chance of finishing school and then moving on to become productive members of society. For adults, welfare can help, like temporarily. It can be temporary assistance in case they need to regain stability or find work again. Welfare helps create opportunities for Americans to rise from poverty and just like create a decent life for themselves.
My name is Blake Smith, and I'm arguing that welfare is helpful and not harmful. Programs like food assistance, also known as SNAP, healthcare and childcare support exist to help families when they need it the most, and they play a huge role in reducing poverty, improving health, and giving people a fair chance to get back on their feet. Welfare isn't about creating dependency, it's about giving people a foundation when life gets tough. It's a safety net that keeps families from falling too far and gives them the stability they need to rebuild. Welfare gives struggling families the base they need to survive and grow. Whether it's help with food, healthcare, or childcare, these programs keep people from falling deeper into poverty. When parents can afford food and childcare, they can work consistently and provide for their families. That stability helps children do better in schools, keep families housed, and strengthens the entire community. Most people who receive welfare only use it temporarily, just long enough to get through hard times. Instead of cutting through programs, we should make sure they reach the people who truly need them. Welfare isn't about keeping people dependent on basic needs, it's about helping them move forward, kind of like a helping hand. Welfare isn't just good for families, it's good for the economy. When people have their basic needs met, they can actually participate in the workforce and spend money in their communities. That helps local businesses and keeps the economy very stable. Programs like unemployment benefits or childcare assistance help people stay employed instead of dropping out of the workforce. And when parents can work knowing that their kids are cared for and their health is secure, everyone benefits. Welfare also gives people the chance to focus on education and skill building instead of worrying about survival. At the end of the day, welfare is about giving people a chance when life hits hard. It makes sure kids don't go hungry, parents can keep working, and seniors can get health care. The goal isn't to keep people on welfare forever, it's to give them the tools and support that they need to become self-sufficient. Welfare isn't a handout. Like I said earlier, it's a helping hand. And when we lift people up instead of pushing them down, our whole country becomes stronger. Thank you.